All right, we'll go ahead and get started. I'd like to thank everybody for coming to this. Microphone on. My name is Chris Gall. I'm the Monroe County Prosecuting Attorney. Thank you, everyone, for coming to this press conference. We're here today to announce a new resource that we believe will have significant public safety, health, and environmental benefits for our community, and that is the Monroe County Pharmaceutical Safe Disposal Program. I want to tell you what it is and also tell you why it is important. The best introduction that I could give for this program is to just quote from a 2011 report issued by President Obama's Office of National Drug Control Policy. And that report is called Epidemic: Responding to America's Prescription Drug Abuse Crisis. We created a link to this report on our website at the prosecutor's office if you want to see the whole report. It says, prescription drug abuse is a significant public health and public safety issue, and a large source of the problem is a direct result of what is in Americans' medicine cabinets. Providing individuals with a secure and convenient way to dispose of medications will help prevent diversion and abuse and help to reduce the introduction of drugs into the environment. So that's our challenge. We need a safe disposal alternative for prescription drugs that is easily accessible for consumers year-round and that will accept controlled substances. That sounds easy, but it's not as easy as it sounds, because under the law, pharmaceutical collection programs typically cannot take controlled substances unless there's a law enforcement officer present. I want to talk about what we're doing here in Monroe County and why it's different than what's been done before. In the past, we've had individual efforts. We had the Medical Roundup, which was an annual event that was sponsored by Triad and the Sheriff's Department, the Prosecutor's Office, and others. And that was a very popular program. We increased the amounts of medications collected every time we did it, and so we started doing it on a quarterly basis. And clearly, there was a consumer demand out there in this community for a safe disposal alternative that is easy and accessible. The limiting factor for us was that in order to collect controlled substances, it requires the actual physical presence of a law enforcement officer. Now, through a cooperative community effort, we've overcome that limitation, and we're trying something new that hasn't been done before, certainly in Indiana. And that is to use a secured, locked metal box, like a postal box, that will remain under the control of law enforcement. It says right on it, property of the Sheriff's Department. Only the Sheriff's Department has the key. Collections are run exclusively by the Sheriff's Department. No one else has access. You'll find that there are 2 collection locations for our pilot project, and both of them are easily accessible to consumers. They are safe, they're indoors, they're in well-lighted areas. There's video surveillance equipment installed, because obviously anytime you're talking about controlled substances, there's always a safety risk for people who are dropping off medications. So we were very careful about where we located these boxes. But using these boxes means that we can have a permanent collection location, not just 4 times a year, but all year long. And you don't have to put a special date on your calendar and try and remember when to clean out your medicine cabinet. You can do it anytime you want. And this program will accept controlled substances. This is something that, if it works here, could become a model for other jurisdictions who are seeking ways to try and tackle these issues. And pharmaceuticals bring up all kinds of issues: public safety, public health, and environmental issues. Why public safety? In our experience as law enforcement, controlled substance abuse and addictions has often been associated with crimes such as property crimes, theft, residential entry, and also it's frequently the motive behind other types of violent crime. So by encouraging people to get these unused, unwanted, expired prescriptions out of their medicine cabinets, get them out of the home, that reduces both the opportunity and the incentive for the commission of such crimes. So this is all about a crime prevention measure. Why public health? Again, I want to quote from the President's 2011 report. Prescription drug abuse is the nation's fastest growing drug problem. Opiate overdoses, once almost always due to heroin use, are now increasingly due to the abuse of prescription painkillers. In 2008, Bloomington Hospital data indicated 292 emergency department visits that were coded as either drug abuse, or well, coded in the category of drug abuse/overdose for either illegal or prescription drugs. Of these visits, 24% were under the age of 17, and another 24% were between the ages of 18 and 25. So we know that a lot of these overdose cases, the majority of these overdose cases, involve young people. Surveys also show that prescription drug use is going up despite decreasing illegal drug use. Where are folks getting their controlled substances? You know, according to the National Survey on Drug Use and Health that's also cited in the President's report, nearly 70% of people who abused prescription pain relievers got them from friends or family members or relatives, while approximately 5% got them from a drug dealer or over the internet. So what's the solution? The President's plan calls for, quote, the development of consumer-friendly and environmentally friendly, responsible prescription drug disposal programs to limit the diversion of drugs, as most non-medical users appear to be getting drugs from friends or family. That is exactly what we intend to do with this new program. This is a community problem, and it needed a local community solution. It required law enforcement, the solid waste district, the hospital, triad, and all the other stakeholders working together to come up with a solution and to make it happen. The Sheriff's Department will run the collections and sort and store the controlled substances under lock and key in the Sheriff's Department evidence room. Without the Sheriff's Department stepping up to the plate and taking on this responsibility, we simply could not do this program. So we very much appreciate the willingness and even enthusiasm of the Sheriff's Department and their evidence technician, Richard McLaughlin, whom we all know as Mac, for making this happen. The Solid Waste District will arrange for disposal through incineration at Covanta's waste burning facility in Indianapolis. We have 2 pilot collection locations for our program, here at IU Health, Bloomington Hospital, in the main lobby in front of the outpatient pharmacy. So when you're done here, if you walk out into the lobby, you can see the box. It is installed. It is ready to go. And at the Solid Waste District, at their hazardous waste facility, at the recycling center on South Walnut, that's our other collection location. Again, we could not do this without the support and the assistance of our community partners. So I want to thank the Solid Waste District for their help and support in developing and implementing this program, especially Scott Morgan, their operations manager, who worked with us enthusiastically to make all this happen. And again, I want to thank IU Bloomington Hospital for providing yet another valuable service that fits within their mission of serving the health needs of this community. I want to acknowledge Mark Moore, the president and CEO of IU Health Bloomington Hospital, who's here with us today. Thank you, Mark, for being here. I also want to acknowledge Bradley Spencer, who could not be here today, who's on vacation, but who is an outpatient pharmacy coordinator for the pharmacy here in the hospital, who was a key person in helping us get this off the ground early on in the process, helped us make this happen as a community service. I want to thank Amanda Roach, the media relations coordinator for the hospital, in helping us organize this event today. And also, it's important for us to acknowledge the Sea Grant Foundation. That is an environmental organization that their mission is to try and reduce water contamination from improperly disposed pharmaceuticals. They actually gave us a grant to fund the purchase of our collection boxes, and that was a big step in moving this forward. So we very much appreciate their generous support, and we hope that this is a program that can become a model for other jurisdictions who are trying to find innovative ways to address this problem. We're holding this press conference today because we want people to know about this new resource. We want to spread the word. We want people to take advantage of it. We're distributing these posters all around the community to senior centers and healthcare providers, churches, government organizations, environmental groups, other community organizations who have an interest in this issue. And we want to make this a success for the community. So help us spread the word. Thanks for being here today. There are some other stakeholders who are going to get up and say a few words. I want to turn it over now to Sheriff Jim Kennedy.
As Chris has so eloquently stated, he's given you the reasons for the program and the protocol surrounding it. I'm here merely to acknowledge the leadership of the prosecutor's office and the other organizations which are providing assistance in this program, and I think it's a demonstration of what can happen when a lot of very diverse groups get together toward a common goal. If we can reduce the number of pharmacy-provided medicines on the street, it'll go a long way toward reducing the problems we have in the sheriff's office with some of the people that we routinely encounter. And Chris, thank you very much for your leadership in this.
Derek Fields, who is the Pharmacy Clinical Coordinator for IU Health Bloomington Hospital.
Thank you. As a community leader in healthcare, IU Health Bloomington is very pleased to be able to be a pilot site for this very innovative program here in the community. As a pharmacy profession in general, we've always been very supportive of take-back programs, but there have been many logistical and challenging things in the process mentioned by Chris earlier as far as getting these medications back from patients. And so we're very pleased to be able to be a part of this and give our community an opportunity to be able to turn these medications in and get them in the right hands. Thank you, Chris.
And now we have Georgia Sheikh from Triad.